nikakuta hiyo mzee akanishika, hata alikuwa ameninolea panga nikatakate, akaniambia ukisema mimi nitakuwa na nitoke huku niende kwingine, siku tunajua.
This is just one of the numerous gender-based violence cases that go unreported in the world. According to statistics, one person faces one form of abuse or another every 5 seconds. And this includes domestic violence, physical, psychological and emotional abuse, sexual abuse or rape, defilement, female genital mutilation, and prostitution. In Kenya alone, there are rampant cases of gender-based violence that are reported every day at family level, informal settlements, both private and public institutions like schools, colleges, universities, churches, mosques, and sometimes even within children care centers.
Cases are there, they are quite rampant, but they are never brought out. You find situations where in the past we used to talk about girls and women being abused so much, but now the aspect of boys is coming in.
Gender-based violence, whose grave consequences include HIV and AIDS and sometimes death, has drawn the attention of US-based philanthropist Mrs. Deloris Jordan, the director and founder of the Kenya Women and Children Wellness Center, a non-profit making organization that is geared towards providing healthcare services to Kenyan women and children who may be victims or survivors of gender-based violence.
We want to address all the helping issues that attain to women and families. I know we are saying Kenya Women and Children Wellness Center, but it also means for families, for men, for their husband. But I truly believe that whenever we can nurture a woman, she's going to nurture her family, she's going to nurture her husband, she's going to nurture her children. So really I see the Kenya Women and Children Wellness Center as a family environment.
Through strategic partnerships, the Kenya Women and Children Wellness Center has designed a 184-bed state-of-the-art hospital that will rest on a 10-acre plot donated by the United States International University, USIU, situated along Thika Superhighway, Nairobi. The proposed hospital will have modern medical and surgical equipment, forensic lab, pediatric unit, burns unit, cancer unit, HIV/AIDS outpatient clinic, the research and training center, gender violence recovery center, and a prestigious family village and daycare, where parents and guardians will enjoy a short stay as their patients will be receiving treatment.
We're looking for modern equipment to come in to be able to address some of the issues that you will not have to leave Kenya, leave the country to go elsewhere. That is some of the main, I think, focus that we're trying to focus on to make sure we do have modern equipment in this facility. Whenever we have someone come in from the village, maybe a child is sick, and the parent accomplished that child, has nowhere to spend the night. So we're going to do a family village, and it allows the family to come in and spend time when the child is ill. They're there for 2 or 3 days, the family have somewhere to spend, to sleep and rest and can be fed. So we do have that coming.